in the last few minutes, please keep your mic during the course of the presentation. There will be a chance for questions and answers later. So it's great to see so many people on the webinar. And I'm going to begin. I hope everybody can see. Subject of today's webinar is Playing with Children's Health, Advocating for Children's Play in Health and Healthcare, a new policy campaign. I'm going to be talking for 10 or so minutes, 10 or 15 minutes. I'm going to hand over to Dr. Wendy Russell, visiting fellow from the University of Gloucestershire and a lifelong practitioner and advocate and teacher on children's play. I'll say a little bit more about Wendy when I come to introduce her. But I'm going to begin. As I said, I'm the Head of Policy and Public Affairs here at Starlight. Because it's quite a large webinar, I want to assume that everybody knows all about Starlight. So just a little bit about who we are to begin with. We're a national charity. We're the national charity for children's play in healthcare. And we aim to support all children in healthcare to enjoy their right to play. It helps them to have a better time in and out of hospital when they're in healthcare, helps to mitigate their mental stress and potential trauma, helps them to recover from illness. And our aim is to ensure that all children throughout the healthcare system have this support from properly resourced health play services. We also campaign, which is what today's webinar is about, for systemic change in the healthcare system to try and make play more widely recognised and better supported for all children by the NHS and by government policy on children's health. The webinar today is going to look at the policy context, which is now dominated by the election, as you can imagine. A brief look at our advocacy work in this space up until now. We've achieved what we want to do next and the approach that we're taking in asking ourselves the question, what should we do next and how can we best achieve it? And I'm going to hand over to Wendy, who's going to give us her insights into the policy landscape for children's play and healthcare and draw on some very substantial research that she's undertaken on the relationship between children's play and well-being. And then we're going to look at what's coming up, what we're planning to do with all of this amazing information. The general election was announced last week. It's going to be on the 4th of July, and that is the policy context now. We were planning this campaign, as you can imagine, for many months, and now we know what the focus is and what the timing is, and so we're really focused on getting some policy asks out within this campaign in order to try and raise the profile of children's play in healthcare as an issue. And so you could say that our campaign kicks off today. We'll look back briefly at our own strategy and where it's come from. In 2022, we launched a set of policy asks. They were featured in this report, which you can find on our website, essentially asking that children's play services be fully reinstated as part of the post-pandemic new normal in the NHS. We wanted new guidance to commissioners on children's play in healthcare and for there to be new national standards for health play services. We wanted a bigger, more integrated and better recognised health play workforce. And ultimately, of course, we wanted funding for adequate levels of health play provision. Partly as a result of that report and our overtures to NHS England, they invited us to set up a joint task force with them, which ran from 2022 to 2023. And the outcome of that task force was new draft guidance for NHS commissioners on children's play in healthcare, new national standards, draft national standards for health play services. I say draft because the task force has produced these documents led by Starlight. They're now with NHS England, who are preparing them for publication. We haven't got a date yet, but of course they will go through the NHS England sign-off process. So we wait to see what they will eventually publish, but we're very hopeful that these documents will be very much like the ones that we produced through the task force. And the third work strand of the task force was looking at professional accreditation and workforce development. And we are at Starlight going to produce our own document on that in June. So the next steps for the task force outputs, the work that the task force has done and what it's produced, are that NHS England are planning to publish new draft guidance for healthcare commissioners and NHS trusts at a date to be confirmed. New national standards for play services also to be confirmed. And we will publish a draft workforce development strategy for the health play workforce in June at the National Conference for Health Play Specialists. And you'll find more information about that on what used to be the NAPS website, which I think is now in the process of transitioning to the new SOPS website. You may know, many of you on this call would know that NAPS, the National Association of Health Play Specialists, is in the process of merging with the Healthcare Play Specialist Education Trust to form one unified national professional body for the sector called the Society of Health Play Specialists. And their first national conference is going to be in June, and that's where we will launch with them and with our other partners, Skills for Health, a new development strategy. All of the work of the task force can be found in this report, which you will also find on our website. So that's what we've achieved to date. When I say to date, the policy function at Starlight only began in 2021-22. So it's a relatively new area for Starlight. And we've done all of that work with NHS England, and we're asking ourselves what next. And how we've gone about deciding where to apply our resources and put our focus is we've used the social ecology model, which is sometimes used in policy circles as a way of analysing different parts of the ecology around a particular issue in order to try and identify where the levers might be, where the factors are that can be focused on in order to achieve change. And so we're looking at children's play in healthcare. This means we're looking at health play services, but the context for those health play services is the wider healthcare setting. And the context for the healthcare setting is the wider healthcare system, the NHS itself. And of course, the context for the NHS is whatever national government policy is for health and healthcare. So it's a huge job to look at that whole ecology and ask ourselves which parts of the system most affect children's opportunities to play. And that's what we've been doing. And to ask ourselves what changes would make the biggest difference. And we're talking about systemic change. How can we achieve systemic change at a policy level? Looking at the ecology again, at the centre of the ecology, direct services to children, families and health play teams. This is something that we're already doing at Starlight, and we will continue to do, and we want to do as much of that as we possibly can with our resources. We are now very much looking forward to new standards. There have never been national standards, detailed national standards for health play services before, and this is what the task force has produced, and which we are very much looking forward to NHS England publishing. and we also, through our Play Champions network, provide training and support for practitioners in the field. So this is something that we're already doing, working with Health Play Services. We're very much looking forward to the new guidance that is aimed at commissioners and trusts. So that's that third ring of the ecology, where we're aiming to, through that guidance and through hopefully the adoption of the guidance by NHS commissioners and trust leaders, we're very much hoping that the healthcare settings themselves will better recognise health play services and the importance of health play services in service design and delivery for children, and that will see a higher profile and eventually more resources being made available to those services. So that work is also ongoing. So now we're really looking here at Starlight at the wider rings, the healthcare system and national government policy, and that's what this campaign is about. All of that work that I've just mentioned continues. It's not done. The guidance hasn't even been published yet, but it's now kind of passed on to NHS England to do that. And so we are looking at how we can use our resources to influence the healthcare system, the NHS, at the wider level, at the policy level, and that means looking at national government policy. And we've deliberately timed the strategy to focus on these outer rings during this year because we knew it was an election year. We didn't know it was going to be as soon. I don't think many people did outside of the Prime Minister's inner circle. We knew there was going to be a general election this year, however, and so we've done a lot of preparation for this, and that's what we'll be talking about now. Before I hand over to Dr. Wendy Russell, I just wanted to set out our stall a little bit in terms of an approach to children's play as a government policy issue and how we're thinking about it. Traditionally, children's play has been conceived, if at all, and I must say it's largely play advocates who see children's play as a government policy issue. Certainly in England, there have been further advancements in play policy in some of the other UK nations. England made some big strides in the 2000s, but not very much since then, it has to be said. But one way to look at it, one way that play advocates do look at children's play, is that it is a cross-cutting policy issue. That is to say, it is very relevant to the policies and therefore the government departments that deal with education, deal with play, deal with culture, so Department for Culture, Media and Sport, planning and communities, so that government department, the Department for Communities and Planning, CLG. But it's a major issue for traffic and transport policy. If you look at the street play movement and the work of Playing Out, they're very focused on road closures and creating safer streets and better management of traffic around residential neighbourhoods. It's also traditionally been seen as a health issue, but it has to be said, it hasn't really been led by health policy in the past. Traditionally, wherever children are concerned in government policy, the lead tends to come from the Department for Education. By far the biggest spending government department on children is the Department for Education. And play advocates have more tended to focus on this area. Children's play within public space, the public realm, planning the environment, child-friendly neighbourhoods, child-friendly streets. That has been a major focus for the play advocacy movement. And so there's been a tension, really, I'd say, between the sort of instrumental value of play for children's education and the domination of government policy on measurable learning outcomes for children, the importance of school academic attainment. So education policy has tended to be the dominant perspective on play from a government point of view, but from an advocacy point of view, it's, and I am generalizing here, it's tended to be on more children's out of school lives and the importance of time and space to play within their local neighbourhoods, their local environments. Play in health has not been a major focus, and let alone play in healthcare, which I think it's fair to say has been virtually invisible as a policy issue for the play advocacy movement, and certainly within government policy. There's very little to be said about children's play at a policy level historically. So we're aiming to change that. And how we're proposing to change it is to take a new approach in how we look at play and think of it as well as a cross-cutting issue, which it is, to think of it as an holistic policy issue where children's play and the importance of children's play to their well-being, resilience, health and vitality should be seen as a central factor in all different policy areas that impact on children's play, including education, culture, traffic and transport, planning and communities, but coming at it from the point of view of children's well-being as being a central and dominating factor in how policy is developed. What can we do to improve children's well-being? And within that, you have to consider the role of play in children's healthcare, because the healthcare system is what drives government policy on health and healthcare, including for children. So that's just a different framing of play as a policy issue that we're bringing into this campaign. And just to cite some kind of trends in policy thinking around health and healthcare, I wanted to share this quote from the King's Fund from February this year, responding to a review of the NHS, a major review led by the Times on the NHS and the wider healthcare system. And their response to it was that there is a lot of agreement about what needs to happen. And this includes creating policies that address health rather than just healthcare, shifting the focus to prevention and early intervention services. And we feel that provides an opportunity to really, when we're talking about children's health, to emphasize the vital importance of children's play. So what we're asking for, and these will evolve over the months ahead, but what we're asking for right now is for a strategic cross-cutting government policy for children's play within health and healthcare. We're asking for the NHS to publish the new standards, guidance and service specifications for health play services. And we want the government and the NHS to commit to a new workforce strategy. And we're going to be producing a draft workforce strategy in June, setting out our recommendations for that. So that's what we're standing for. And I'm now going to I'm not going to yet, because I wanted to share this one. Just in terms of the discourse on social policy in general, within healthcare in particular, this slide was shared by a senior paediatrician at the National Conference for the RCPCH in Glasgow last year. And I thought it was interesting from a play advocacy perspective, because what Dr. Kleber was saying, citing Julia Unwin, and his speech was called Leading for Kindness. It was the keynote address, and it was called Leading for Kindness in Healthcare. What he was essentially saying was that within this analysis of kind of the lexicon within the discourse on social policy from Julia Unwin, a sort of leading social policy practitioner and writer and thinker, this right-hand lexicon, the relational lexicon, is an emergent lexicon that emphasizes and focuses on different factors, different qualities than the traditional left-hand lexicon. Things like well-being, desire, friendship, spontaneity, discretion, intuition, warmth, storytelling, metaphor, as distinct from scrutiny, value for money, boundaries, targets, evidence, data, accountability. And it's not that one's replacing the other, it's simply that this is overlaying and becoming an increasingly important factor in social policy discourse and development. And I think this offers great hope for play advocates, because although it's not there, you can well see how children's play would sit very comfortably in the right-hand lexicon, not so much in the left-hand lexicon. So I just wanted to share that before I hand over to Wendy, who's going to talk to us about the policy landscape and the trends. And I just wanted to share this, the cover of the briefing for Wendy's literature review. That is to be found on the Play Wales website. And I think that's the briefing. There's now a much fuller summary of the literature review that you can download from that website. And I wanted to share the cover of one of the key works that Wendy cites in that review, just because the picture, although it's not, the book isn't about children, it's about an approach to human development and how that could influence thinking and policy and research. But the image is so evocative of the power and the vitality and the essence of children's play as being key to human potential and human development. So now it's my great pleasure to hand over to Dr. Wendy Russell. As I said, Wendy's a lifelong advocate, practitioner, teacher, writer and researcher in children's play. She's a visiting fellow of the University of Gloucestershire, as well as being an independent writer and researcher. And she's produced some really seminal literature reviews, and many of her own papers are well worth reading as well. And this latest one, Playing and Being Well, we feel has a lot of very helpful insights for our campaign. So over to you, Wendy.
Thank you. Will you stop sharing?
So I'm going to stop sharing so that Wendy can share her own.
Uh-oh, come on. There we go. Can everybody hear me? And can you see my slides?
Looking good, Wendy.
Brilliant, thank you. Thanks, Adrian, and for that introduction as well. I think a lot of the stuff that I'm going to say picks up on some of the themes that Adrian was outlining as well. And as Adrian said, what I bring to this campaign is a background in researching children's play and social policy, but not specifically in health policy. So I'm going to be drawing mostly on my research in Wales for this presentation. Starlight is a UK organisation, so I think a lot of this will be relevant. And hoping to use this to begin the development of a framework or a narrative for the campaign. So there's several reasons why I think Wales has a lot to offer for a campaign to take place seriously in health and healthcare policy, although most of these aren't directly to do with Welsh health policy. The first three are examples of the Welsh Government's often groundbreaking approach to policy and lawmaking. So one is that since its inception, and my forward isn't working. That's lovely, isn't it? Haha. I'll carry on talking, it might catch up. Since its inception, the Welsh Government has taken a rights-based approach to policies for children and young people, incorporating that into law through the Children and Young Persons Rights Measure in 2011. Equally, since its inception, the Welsh Government has taken play seriously. In 2010, as part of its Children and Families measure, it introduced a statutory play sufficiency duty on local authorities to assess and secure sufficient play opportunities. I've been involved in 4 research studies into this duty. The third piece of legislation is the Wellbeing of Future Generations Act 2015, which makes Wales a well-being economy, and that means that they don't prioritise GDP as the only measure of progress, but they place economic well-being equally alongside current and future social, cultural and environmental well-being. Recently, 10 years after the official commencement of the play sufficiency duty, the Welsh Government undertook a ministerial review of play. I was on the steering group for that, and I had a hand in developing the report as well. And the review shows that the government's ongoing interest in and commitment to children's right to play. And finally, as Adrian was saying, with colleagues Mike Barclay and Ben Towell from Ludicology, we were commissioned by Play Wales to undertake an extensive review of recent research into children's play. And the briefing and the summary on the website, and the full version is due out very soon. So the title of the review is Playing and Being Well, and it considers recent research in childhood studies, in policy, the role of play in children's well-being, children's play patterns and practice-based examples of supporting children's play. The focus on well-being in this review came from the literature itself, and it also fits really well with the overarching reach of the Wellbeing of Future Generations Act. So since the focus of our review is on well-being, it's probably worth saying a few words about the relationship between health and well-being. So the World Health Organization defines health as a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. So a lot of people do differentiate health and well-being, but however they're defined, health and well-being affect each other, and they're inextricably linked to the social determinants of health. So what we found in our review of childhood studies and play research was that there have been significant changes over the last 15 years or so across both natural and social sciences, away from studying separate things in isolation and towards what's termed a relationality. And at its most radical, this relationality sees stuff, they call it phenomena, things like play, bodies, space, life itself. They see these phenomena as constantly in the process of becoming through contacts with everything else. So with others, relations with others. So this might be tangible things like other people and animals, or material objects, but also less tangible things like feelings, affect, atmosphere, or systems like timetables, codes of behaviour, systems of oppression. And these relational approaches
between 2 and 4. Yeah.
Can I ask everybody to please mute themselves? Thank you.
Thanks. So these relational approaches both build on and challenge dominant narratives of childhood and play. So they move away from the single ideal universal child, challenging how this produces expectations of norms and therefore what's abnormal. And relationality also helps us move away from those kind of stark binaries that don't really work, like adult, child, nurture, nature. I should point out that this relational turn is still very much only evident in academic research and has yet to have much impact beyond this. There is some potential to consider relationality in policy, but this has to work really hard against dominant narratives. And one of those narratives is the social investment policy model. So this model sees the allocation of resources as an investment in children who will become future producing and consuming citizens. So we see this in education, but also in health policy. This isn't necessarily a bad thing, but bringing the language of economy into social policy moves it away from relational notions of public good and towards a transactional public policy focused on those things that Adrian was talking about in the rational policy lexicon stuff on performance indicators and outcomes. This social investment model also leans towards a deficit understanding of children, so where children are seen as incomplete human beings. And in the UK, this is the political bit, neoliberalism, the social investment model and austerity measures have combined to increasingly make citizens responsible. So policy agendas are seen primarily as individual issues, things like obesity or mental health. And this implies blame, particularly on kind of poor mothers in all senses of the term. Again, while there's great value in working with people to improve their own health and well-being, the research shows that much of this work is benchmarked against ideal norms and has until now shown only a passing acknowledgement of the conditions of people's lives, the social determinants of health. Nevertheless, there's hope for some moves towards recognising contextual issues and the politics of these. And one example is greater acknowledgement of the links between health inequalities and broader inequalities. So looking at the relationship on well-being, we reviewed the relationship, the literature on well-being and the literature on policy. And from this, we came up with what we called a relational capability approach. So this draws on the capability approach developed by philosophers Amartya Sen and Martha Nussbaum. Sen says that well-being arises from the opportunities, resources and freedoms for people to be able to be and do what is of value to them. So a capability is out there, it's like resources and opportunities, and it's also personal in terms of people's capacity to make the most of those resources, and these things operate at interrelated personal, social and environmental levels. A relational capability approach pays attention to the complex meshwork of conditions that help children become capable of supporting their own health and well-being. In this sense, it's a strengths-based approach that can address health inequalities. It can also operate at levels from prevention to complex care and including mental health. So wrapping all that up, a relational capability approach to playing and being well means that when conditions are right, children can create their own well-being. A relational capability approach to well-being needs to pay attention to the conditions, the spatial, temporal, affective conditions that support the resources, opportunities and freedoms and therefore capability for children to play. And this is a quote from the review. The evidence contained within the review provides a strong argument that working towards the production of these conditions has an ethical, social, legal, environmental and economic basis. Children's capability to play is of political importance, both for its intrinsic value as a social justice issue and because of its instrumental value in terms of its contribution to the well-being of children and communities. So with that as a basis for further thinking, let's go back to that question about health, taking place seriously in health policy. We all know, we're speaking to the converted here, we all know that play is important for children, families and communities. There's perhaps three key arguments that can be used to promote play in policy generally, and this probably also works for promoting play in health and healthcare policy too. So that's play's intrinsic value, that play is important for its own sake. It's play's instrumental value, that play is good for things other than playing, things that are of direct interest to policymakers, and that the right to play is enshrined in the UN Convention on the Rights of the Child. These three arguments are of course interrelated, even though they're sometimes seen as being in tension with each other. So I'll say a little bit about each, drawing mostly again on our review. Looking first at play's intrinsic value, the value of play for its own sake, this embraces the joy, the pleasure of playing, and it's the pleasure of playing that motivates children to play more. And this pleasure can arise from play's nonsense and also from the way that children experience the vitality of emotions like fear, anger, disgust, surprise. In relative safety, it's only playing. For example, pretend play, games of tag, chase, rough and tumble play, risk-taking, rude rhymes, toilet humour, horror stories, video games, generally mucking about. Such moments of joy are what make life worth living, if only for the time of playing. but the pleasure of playing also has instrumental value. Playing with emotions can help prime neural networks to respond flexibly and creatively to new situations without overreacting to them. In addition, playing in ways that are valued by the player releases neurotrophins that can have more lasting protection against depression. This is so much more than the truism that play is fun. Moving on to play's instrumental value, I don't need to tell you this bit at all, but it's worth reiterating. Supporting children's play in healthcare settings helps give children a sense of control over events. It can help create a sense of continuity with everyday life, to reduce anxiety, fear, stress, even pain, to help children and their families have a more positive experience of being in hospital, and it helps to minimise the chances of trauma. And play specialists can help children prepare for and engage and cope better with the procedures and treatments through playing. More broadly, play is an embodied and an affective thing. We feel it physically, it's constantly shifting, and it's this that adds to play's vitality, a sense of being alive. All this contributes to physical health and strength, muscular, skeletal, cardiovascular strength, as well as to emotion regulation and healthy stress response systems, as I've already said. The importance of attachments is crucial for well-being, and play is an excellent arena for developing attachments to friends, caregivers, other trusted adults, animals, things like special toys, and to places. All this contributes to children's sense of security and belonging and the feeling that what they do matters. Playing is how children participate in everyday life. In healthcare settings, it's about children actively participating in their treatment. And we shouldn't dismiss the importance of nonsense in playing, that what-if way that children approach the world when they play, not being bound by the rules of the real world. All that supports creativity and innovation. But I also want to say, and this is hard for us play advocates, we shouldn't over-romanticize play. Ultimately, play is amoral. It can be harmful, and it can reproduce inequalities and cruelties that exist outside of play. So to sum this bit up, playing has both intrinsic and instrumental value. That is, it's of value for its own sake, and it also brings value for things other than playing. Although we shouldn't think of these two kinds of value as opposites, it's the intrinsic value that motivates children to play, and that therefore brings instrumental value. Nevertheless, play's instrumental value can feed into both preventative and remedial discourses for play in health and healthcare policy, in line with current concerns about things like obesity, mental health issues, and more. The third way of framing the importance of play in health and healthcare policy is that of children's rights. The first point to make here is that the UK is a signatory to the UN Convention on the Rights of the Child, which is a legal instrument. Even if the UK government has not incorporated the convention into domestic law, as Wales and Scotland have done, it still has implementation and reporting responsibilities. And given this, a rights discourse could add heft to any campaign and can work with both intrinsic and instrumental value. We should remember that all the articles within the convention are indivisible, but we can highlight Article 2, non-discrimination, Article 6, the right to life, survival and development, 12, the right to express views, 15, freedom of association, 24, the right to health and health services, and 31, the right to play. Realising the right to play contributes to the realisation of other rights. I just want to say a few words about the concept of play sufficiency and its potential in policy terms. Both Wales and Scotland already have a play sufficiency duty, and it's a recommendation in the UN Committee on the Rights of the Child's General Comment 17 on Article 31. A super brief summary of our research into the duty in Wales would be that there is still, after 10 years and many challenges, considerable enthusiasm for play sufficiency at local and national level. Our research is focused on the principle of creating the conditions that can support playing. So we were working with a relational capability approach before we named it. The work's been hampered by austerity measures, but at the same time, this has given rise to innovations through the need to think differently and be open to possibilities. A huge part of the value of play sufficiency is the requirement to work cross-professionally. This has been an absolute game changer. So play sufficiency officers have been working with planners, housing, landscape architects, highways, active travel programs, education, health, and so on, to think beyond the provision of playgrounds. All these different perspectives on creating conditions for children to play wherever they are helps to build a collective wisdom, and key to this is the wisdom of children themselves. Finally, a key finding from our research is that the requirement to work cross-professionally needs to be matched with a real policy alignment at both national and local level. This is beginning to happen in Wales. So play sufficiency is beginning to appear in other policies, and one example is Public Health Wales's Planning and Enabling Healthy Environments, which talks about child-friendly neighbourhoods that can support play. So what might a relational capability approach to children's play and health policy look like? Adrian's talked about this ecological framework, and it fits well with a relational capability approach. Work across the circles includes gaining recognition for the importance of play and healthcare at all levels, as well in health policy more broadly. And in the report that Adrian talked about from the task force, the co-chairs say there is a palpable momentum for change in children's healthcare. I would say too that there's a palpable momentum for change in other areas of play advocacy. So I think that this can help build into play's moment for recognition in policy. Creating conditions for babies, children and young people to do and be well through their capability to play can address current trends in espoused health policy. Things like partnership working and co-production are embedded in integrated and partnership systems across the 4 nations, offering opportunities for working with that collective wisdom that can arise from working with local authorities and voluntary and community organisations. There's opportunities here also for working with wider play and playwork sector across strategic planning and delivery levels, across universal, targeted and special need. There's some good work going on already in this respect. Health inequalities is a topic embedded in much of health policy. Tackling health inequalities means paying attention to the social determinants of health. And there's some interesting work going on here in terms of marmot places, and I can say more about that if people are interested. Prevention is also embedded in health policy documentation, and it features highly in the Labour Party's Child Health Action Plan. I acknowledge that the reality on the ground might not match aspirations in policy documents, and I'm speaking to a lot of people over the next few months to see how these trends might play out in the real world. Nevertheless, the principles are there, and the capability to play can help across all levels of healthcare, from public health and prevention to acute need to long-term and complex needs, and we can use those principles to promote our cause. So finally, what might all this look like in a policy campaign for embedding children's play into health policy? And there's 4 kinds of provocations that I want to throw out there, questions if you like. The first is, what's the vision? So if you were to wake up tomorrow to find children's play embedded in health policy, what would that look like? The second one is, how might this differ across levels of influence? How can the campaign be made relevant for the whole of the UK? And how can it be addressed at national, regional and local levels? The third area is, who should a campaign be working with? How do we build those policy networks and advocacy coalitions to make a big noise for this? And finally, we should be linking with and aligning with a lot of other play campaigns that are going on at the moment. So I'm going to finish there so that we've got some time for questions. and answers. So thank you very much, and I'll stop sharing.
Thank you so much, Wendy. That was brilliant, as always. I'm just going to finish off before we open up for questions, briefly sharing what to look out for in the months ahead. What are the nuts and bolts of this campaign for Starlight, which you can imagine we've been recalibrating almost by the minute as we're responding to the announcement of the election. But as things currently stand, it looks like this. Can share. Can everybody see that? So on the 11th of June, which is the new International Day of Play, announced by a wide range of international play advocacy networks, including the UNCRC and the International Play Association, with many other partners. It's a big new international day. This is the first of what will become an annual event. And we've decided that that will be the day that we will go large with our policy asks. So there's a lot of work going on behind the scenes to be ready for that. So look out for that date, 11th of June. On the 21st of June at the SOPS conference, NAPS SOPS conference, we will be launching our draft workforce development strategy. I say draft because we want the whole sector to have a chance to comment on the proposals and give us the benefit of your own experience and aspirations and tell us what you think of the document. So that review will go on over the summer, and then in the autumn we'll publish a final strategy and use that as an advocacy tool as well, because workforce is a key to any growth in health play services. Of course, we need the qualified staff to be able to deliver those changes. 4th of July, I'm sure I don't need to tell you, is the date of the election. So we haven't got long to press our case within the current campaign. But all the work that we had planned for the rest of the year is going to carry on. The focus now will be, of course, that we will be in a position to know what the current government is and what their policy stall is that they've set out on the NHS and on health policy and child policy more generally. So we'll have a kind of a fixed target, if you like, for our longer term policy advocacy work. And that will consist of a live streamed symposium that we're running with PEDAL, the University of Cambridge, in September, 26th of September at the Royal College of Paediatrics and Child Health. It's going to be a small event, but it will be live streamed and you'll be able to join it online. And then in mid-October, during Play in Healthcare Week, we will be launching what will now be a detailed set of proposals for the new government on what we believe they should be doing and what the evidence suggests would be the most effective way to promote children's health and well-being in healthcare and in the wider healthcare system by supporting better resourced and more health play services. And then finally, as I said earlier, we are waiting for NHS England to publish new standards and new guidance on children's health play services in the NHS in England. And of course, that will be a seminal moment, we believe, for this field, and will itself, we hope, help to raise the profile with policymakers of this really important area of healthcare, which has hitherto been widely overlooked. So that's the end of the presentation. Thank you very much to Wendy. It just remains to throw the floor open if there are any questions in the remaining 10 minutes that we have, or it's about 8 minutes, I think. Please put up your hand if you have a question for Wendy or myself? Or indeed a comment. "78 people on the call. I'm not sure if I can see if somebody's raised a hand. Presumably it will flag up that somebody has, and then I might just invite you to jump in. Or you could put a question in the chat if you're too shy to ask. But somebody's asked about the slides. We customarily share a PDF of our slides. I don't want to assume anything about Wendy's slides, but we will talk to her afterwards and see what she's happy to share or not on that. Fran, is that Fran Greenaway? Do you have a question?
Yes. Hello, how are you? Thank you very much. So my question really is, well, more of a statement really. I know that you were on the call that we had for the pathway for MRI with the South and Southwest groups, and it's just to sort of find out how we can make put into the policies or the information that you're gathering for all of the information, that although government's not really recognising some of the things, that health play specialists are being put in a lot of pathways for various procedures or treatments. And at the moment, obviously, there aren't enough play specialists available for that. So it's just to sort of bear it in mind, it ongoing, really. I don't know what your thoughts are.
Thank you, Fran. That's a really helpful point to make. Yes, we're aware that there's a growing interest in the efficacy of health-based services in some of the treatment pathways that are being developed across the NHS, and we are, thanks to people like yourself and Catherine, who I can see is also on the call, putting us in touch with people leading on the development of those pathways. We very much hope to highlight the role that play services and health play specialist interventions are having in helping to develop those pathways, and they will all be fed into the various briefings and presentations and representations that we're making to not just to the NHS, but to health department officials as well, Department of Health officials and ministers if we get the chance. So please, yeah, I mean, we might just maybe reach out to you after the seminar, Fran, and ask you some more about that. We're already in touch with Catherine and some other people that she's put us in touch with across those networks. It's all really helpful, and just collating all of that information and data and presenting it to officials is just so helpful. So thank you.
Okay, thanks very much. Thank you.
Any other questions or comments? All right. Comment from my colleague Sandy that we've put out a call for evidence. Yes, please do have a look at that link that Sandy's put on there in case any of you on the call have any research. It doesn't even have to be published, I don't think, as if it's something that you're able to share. It doesn't have to be in the public domain, as long as obviously you are at liberty to share it. We're just looking for evidence that can help to begin to make the case, because as you will all be aware on this call, much as we in this room all believe in both children's right to play and the vital importance of it in their lives, not least when they're sick and in hospital and healthcare. If we can demonstrate the efficacy of spending on these services in terms of cost efficiencies for the NHS, that massively helps to make the case and to be taken seriously when we're in the policy room, if you like. So yeah, thank you, Sandy, for that. Catherine, you have your hand up.
I'd Hi, thanks, Adrian. Just reflecting on the two comments there, and Fran mentioned there's some work we're doing in the Southwest Surgery and Children Network around ensuring MRI pathways are going down a kind of awake route where appropriate and reducing the amount of general anaesthetic required, and that really requires access to play resources and play teams. And I think, you know, putting things at a national level and advocating them, but also at a regional level and saying this is what we would like within our region is really important. And that also links in nicely with that comment, because actually our colleagues in Southampton kindly, sorry, not Southampton, Oxford kindly shared some work they done about the cost effectiveness of, well, the cost benefits of running MRI pathways awake versus a GA and the cost savings that that has. And it's not being done for cost savings, it's being done because it's a better experience for the child and it's safer and all of those things. But actually, when you can demonstrate patient experience improves, patient safety improves, and it saves money, I think building some of those cases together will really help as well to kind of move that forward at a regional level. So happy to share. I think we already have done, but if I haven't already, I can share the work that our colleagues have been doing. I'm sure the Oxford team would also be happy to share any more details as well. Thank you. But great, thank you for that, and nice to know where some of the timelines are, and hopefully we can meet again to move things forward with you.
Thanks very much, Catherine. Really helpful. It's time for one final question.
Adrian, did you see there's a question from Michelle in the chat? Is there any mention or consideration for the need for mandatory health play specialist registration in your policy ask?
Ah, see that one. Yes, I think it's fair to say that has been one of our long-standing policy asks, and it's one of those. It's one of those things that we've included in our recommended guidance. Whether NHS England eventually publishes everything that we've proposed in the guidance document remains to be seen. So there's just that caveat. Ultimately, you know, we made the judgment call that whatever guidance and or standards were produced within this space would have more weight, more reach, more status, and therefore be much more likely to be adopted and implemented if they were published by NHS England, as opposed to Starlight. And it was a joint project anyway, the task force. But NHS England, as things stand, are still planning to publish those documents. And that is one of the things that will be part of the guidance, is that health play specialists employed as such should be qualified and registered with the professional body. And we're asking government, of course, to say yes, we support this guidance, and we want the NHS to adopt the guidance. We just need, if the government were to flag it up that, we consider these documents to be an important step forward for this area of children's healthcare, that would be really helpful. They have been acknowledged in Parliament that this work is carrying on by a health minister of the current government, obviously. And so it is something that is on the government policy radar. And what we will be doing is pressing the new or returning government to follow through on that, and to give a clear steer to the NHS that these documents are important and they need to be both published, but also, more importantly, adopted and implemented across the NHS. That brings us to the end of the webinar, I'm afraid. So it just remains to say thank you all for being here. Thank you so much to Wendy, Dr. Wendy Russell. That was just so enlightening and so helpful to us in our thinking as we take this work forward to try and make the case to national policymakers on all sides for why children's play should be a really important consideration in their new thinking and policies for children's health and healthcare. Thank you all for joining us, and hopefully we'll see you at the next webinar. Thank you, everyone. Bye-bye.